Carpal tunnel syndrome, or CTS, has shifted from being a rare medical concern to a widespread occupational health issue affecting professionals across many industries. In recent decades, the prevalence of CTS has grown, especially among those performing repetitive tasks like typing, assembly line work, or using power tools. This rise is closely tied to modern work environments, where ergonomic risks and repetitive hand movements are common. CTS doesn't just cause discomfort, it can disrupt sleep, reduce productivity, and even force career changes. The economic impact is significant, with increased healthcare costs and lost productivity affecting both businesses and society. Recognizing CTS as an occupational disease has prompted employers, healthcare providers, and policymakers to focus on prevention, early detection, and effective management strategies, aiming to protect workers and maintain a healthy, efficient workforce. Development of carpal tunnel syndrome in the workplace is influenced by a mix of anatomical, biomechanical, and environmental factors. Jobs that require repetitive hand and wrist movements, forceful gripping, or awkward wrist postures, such as those in manufacturing, healthcare, construction, and even music, are particularly high risk. Women are more frequently affected, partly due to hormonal factors and the nature of tasks they often perform. Other contributors include poorly designed workstations, lack of ergonomic training, and insufficient rest breaks. Vibration from tools and prolonged use of keyboards or mice also increase risk. Beyond workplace factors, individual susceptibility like anatomical differences or underlying health conditions plays a role. Understanding these diverse causes is crucial for designing personalized prevention and intervention strategies, ensuring that solutions fit the unique needs of different professions and workers. Diagnosing occupational carpal tunnel syndrome involves a careful review of symptoms, physical exams, and specialized tests. Common symptoms include numbness, tingling, and weakness in the hand, especially in the thumb, index, and middle fingers. These symptoms often worsen at night, disturbing sleep and daily functioning. Physical signs like muscle atrophy and difficulty gripping objects are also key indicators. Diagnostic tools such as nerve conduction studies and electromyography provide objective evidence of nerve dysfunction, confirming CTS and helping assess its severity. Early diagnosis is essential to prevent long-term nerve damage and maintain work capacity. However, access to diagnostic resources can vary by region, affecting how quickly workers receive care. By combining clinical expertise with advanced testing, healthcare professionals can tailor treatment plans that address both the medical and occupational aspects of CTS. Preventing and managing occupational carpal tunnel syndrome requires a proactive, multi-layered approach. Ergonomic interventions like adjustable workstations, proper keyboard and mouse placement, and wrist supports are proven to reduce risk. Regular breaks, job rotation, and education on safe hand techniques further help protect workers. For those already affected, early treatment with wrist splints, physical therapy, and activity modification can relieve symptoms and prevent progression. In severe cases, surgical options may be necessary. Collaboration between employers, occupational health specialists, and healthcare providers is vital for implementing effective workplace policies and rehabilitation programs. These efforts not only improve individual well-being but also enhance overall workforce productivity and reduce economic burdens. As research advances, ongoing clinical trials and new technologies continue to refine prevention and treatment, aiming for safer, healthier workplaces for all. Carpal tunnel syndrome's impact goes far beyond the individual worker. The condition leads to substantial economic costs, including healthcare expenses, compensation claims, and lost productivity. In the United States alone, CTS-related costs are estimated to reach billions annually, affecting employers, insurance systems, and the broader economy. Disability claims and prolonged absences from work can strain Social Security and healthcare resources, while affected individuals may face reduced income and career limitations. These challenges highlight the importance of comprehensive prevention, early diagnosis, and effective management strategies, not just for individual health but for the sustainability of entire industries. By investing in ergonomic improvements, workplace education, and collaborative healthcare solutions, society can reduce the burden of CTS, support workforce participation, and foster a healthier, more productive future.